The president has signed a $1.3 trillion budget bill that'll finance the federal government through September. There's some good news and some bad news for some health care and coverage programs in that bill, and we'll take a quick look at that today. Now, this emerged midweek, about 2,200 pages worth. It was introduced and 48 hours later became law. Now, this wasn't without drama. There were tweets very quickly that said the president planned to veto the bill that came before him, and then he very quickly signed it instead. They were facing at the federal government a very tight timeline. March 23rd was the deadline established from a stopgap bill signed in February, preventing yet another government shutdown. Now, the amount of money allocated for programs across all federal agencies was in hot dispute. Whether or not it would reach the level that it did, $1.3 trillion, wasn't really expected by a lot of agencies. Instead, that was indeed approved, causing some consternation by some of the more fiscally conservative members of the GOP and some pundits. Others were quite happy with the programs that were ultimately funded, some of those being some health care programs. So we'll talk about those. But there's also some notable gaps. There was talk that maybe some market stabilization money for the Affordable Care Act might be included, some funding for cost-sharing reductions in the marketplace, some federal reinsurance, some additional Section 1332 innovation flexibility for states. None of that was included. Instead, there were some enhancements made around opioid and mental health programs, seen as a good thing, and some other innovation programs. Let's take a quick look at what that looks like. Department of Health and Human Services was written into that $1.3 trillion bill at $78 billion, an increase of $10 billion of what they were currently funded. CMS stayed the same. Opioid crisis funding got a $2.55 billion increase. SAMHSA got a $1.3 billion increase, and there were new initiatives funded under this opioid crisis funding level, and that included specific areas, rural, underserved areas were written in through the National Health Services Corp. So there was a real emphasis on making sure there was finally some opioid money written in and some increase in funding for mental health programs, including certified community behavioral health clinics. Now, HRSA, the Health Resources and Services Administration, also saw about $7 billion, and this included money for the Children's Hospital Graduate Medical Education Program, the Healthy Start Program, and the Maternal and Child Health Block Grant. National Institute of Health saw a $3 billion increase across all of their institutes, about $37 billion total for their budget, and the Center for Disease Control saw a $1.1 billion increase, making their total $38 billion. Now, much of that CDC money was actually coming from other pots of federal money. They saw about $800 million slide over from the Affordable Care Act's Prevention and Public Health Fund into their budget, which has a couple public health departments scratching their head a little bit about how they're supposed to achieve their objectives if their money got reappropriated to the CDC. Overall, though, many people are arguing that these expenses for disaster preparedness, for response, getting the money that they needed to be able to serve some public health crises might balance out. So there's a little discussion of just the appropriate way that this money was reaching the different agencies, but overall an increase for the Center for Disease Control. Now, like we said, this spending bill did not fund efforts to reduce premiums through cost-sharing reduction payments. It did not fund any reinsurance programs, even though states are trying to ask for waivers to do that themselves. Congress did, however, impose more reporting requirements on the Affordable Care Act. They called it transparency language written into the spending bill, and instead what they're actually doing is putting quite a burdensome reporting requirement on Centers for Medicare and Medicaid Services. ACA-related spending by category, since its inception, now has to be recorded on regularly. Information on the number of employees, contractors, activities involved in implementing, administering, or enforcing provisions of the Affordable Care Act will now be required. So enhanced reporting requirements, another way to add a little bit of burden to that department, another way, yet again, to chip away at the Affordable Care Act. You can read a couple articles of interest that talk about the spending bill, a little bit of the politics behind it, some of that consternation we mentioned about which agency is getting which money, and the last time in history we saw a spending bill come up for a vote that quickly, within 24 hours, up for a vote within 48 hours, getting signed into law. I think your memory might be refreshed. We go back to the Ronald Reagan era, the last time we saw something of this magnitude come up so quickly. Unusual circumstances, but we have seen it before. You can read these articles if you have questions or thoughts or anything on this subject. we'll be visiting it more as some of the money actually hits the road, and we can see some of the impact of the opioid and especially mental health funding as it goes to different agencies. And you can do all of that at healthwatchwisconsin.org. Thanks for joining us.